Greetings from the NAACP, Roy Wilkins, Mid-Manhattan Branch. Our health is our wealth. Join us tonight for engaging presentations on the hearing impaired by Christine Dudley. Preserve Our Legacy by Shayna and Brett Milius. Open Kitchen by Josh Wessler and Sarah Frank. And a brief message from the Alzheimer's Association. We come to you from the Mid-Manhattan Branch.
I am Babette Hudson, and I am the chair of the Health Committee. If I could ask my other Health Committee members to join me up here, since it's been vacated. Okay. Well, you are on the Health Committee. So what we're doing this time, each year, the Health Committee tries to reach out to the community to do a variety of different topics. And what we looked at this year when we decided what we wanted to present, we decided we wanted to present some of the things that we're not used to talking about in our communities. We're always talking about hypertension, we're always talking about diabetes, we even don't talk a lot about HIV. There are a couple of things in our community that we don't talk about. We don't talk about, as people of color, being donors, such as bone marrow. Okay, we don't talk about things like that, so we're going to have a conversation about that this evening. We're going to talk about our health, because as you know, as a people, we tend not to always be as healthy as we should. And we're also going to talk about the hearing impaired. Earlier this year, our president, Jeffrey Eaton, came in and he said he had gone to a banquet that was hosted by the National Action Network. And he came back and he was really excited. And he said, the banquet was all about people who were deaf. And he said to me, I never think about that. And the attention that it brought to me is that a lot of people don't think about it. And we are blessed this evening to have Christine Dudley in our midst, who is the head of our HIV ministry at Canaan Baptist Church.
Not HIV.
Oh, did I say HIV? I'm the head of the HIV ministry. That's my job. The head of the deaf ministry. Okay, HIV is me. Okay, and she's here, and I immediately went to Christine and I said, I need your help. I need you to come over to the branch and just do some things with our organization on the deaf, and she consented. So I give you Christine Dudley.
Thank you. I am really pleased to be here this evening, and let me just acknowledge that we have two student interpreters who have volunteered to come and work tonight, and the gentleman here is the board chair of the New York City Black Deaf Advocates, and then we have some other members of our Interpreter Advocates Committee at National Action Network, and I just thank them all for coming to support. But first, let me thank your president, Mr. Jeff Eaton, and also District Leader Wilma Brown Phillips for just remembering us. They participated in our House of Justice Deaf Club's Deaf Humanitarian Awards banquet, which was held in February. And I suspect they had what I call a wow moment. We thank them, but we also thank the Health Committee for extending this invitation. And we are humbled because it means that our February banquet was successful in breaking down another barrier between African American hearing community and the African American deaf community. But let me be clear, I am not deaf. So I do not speak for the deaf. I speak as a hearing interpreter and as an advocate who works with Black deaf community and who supports the Black deaf community and who in the past has also had a wow moment. So for years, I have been going to the Black interpreting and the Black deaf organizations, and I have stated that people who should know about them do not know that they exist. They don't know that they exist as an organization, and they don't know that they exist as a community. So you see why I am honored to be here, to share my knowledge of this group's existence. So come, I want you to just go back with me. I'm going to take you back 16 years ago when I first entered this field. When my instructors at the Sign Language Academy told me I had to become involved in the deaf community, I had no idea about a deaf community. I didn't know where to go, and I didn't know that it existed. But at that time, I had been working for 30 years with the city of New York, and I hired interpreters for deaf clients. So I knew about deaf people, but I did not put it together to think of them as a community of people with their own culture, with their own values, with their own customs, and with their own history. A fellow student at the academy led me to a group of African American interpreters who stressed, if you want to learn the language, you need to learn about deaf culture. You need to become involved in the deaf community. So I heard this over and over and over. Deaf culture, deaf community. And they directed me to several organizations, one of which was the New York City Black Deaf Advocates, where I started attending their monthly meetings. These meetings were run by skilled, deaf, and hard of hearing people. I was mesmerized and even intimidated trying to sort out this new experience. Like many of you, and I'm looking at you because some of you are in my age category, grew up hearing terms like deaf and dumb, deaf mutes. These were negative labels that were integrated into my mind when I was a child. They're dangerous labels and myths, and they created stereotype views which was hidden from my consciousness. And I'm hoping that they were hidden from my attitude and my behavior. I don't know. But I was forced to evaluate my own thoughts about deafness. I was forced to deal with my own ignorance. So over the months and years, I became a conscientious student, learning from the deaf about their struggles and their achievements. I observed resilience against a society not ready to budge from tactics of discrimination and oppression. But it was not only about their color. It was also about standing before people with the same skin color, who flaunted superior attitudes, or who looked at them with pity, or who viewed them as a non-entity, unimportant, and irrelevant. Some professionals today still believe that deaf people are only able to do so much. And so consequently, there are many young black deaf who are not helped to realize their full potential or obtain proper training for advancement. Today, familiar problems faced by black deaf people are undereducation and underemployment. And I know that sounds familiar. So I raise a question to all of you. What comes to your mind when you think about deafness? I heard the term hearing impaired. Hearing impaired in the deaf community is not a word that is used. They are proud of their culture, which is deaf. So anytime you speak about deaf person, you should say the word deaf. That's what they are. And most of them will tell you it's with a capital D, not a small d. So in June of 1999, we were newly chartered as the National Alliance of Black Interpreters. And we decided to have an open house to introduce ourselves to the community. We sent out invites to both the deaf and the hearing community, and the deaf, of course, responded. I was chair of public relations at that time, and so I personally invited several individuals who represented the court system, the theatrical community, and the civil rights community. And amongst them was Dr. Wyatt T. Walker, who was my pastor and the senior pastor of Canaan Baptist Church, and Reverend Al Sharpton, who was president of National Action Network. Now we know These are two civil rights activists who are used to coming before people of various backgrounds. Well, guess what? I don't think they were quite prepared for what was going to be presented to them that evening. When they walked into the facility on East 83rd Street First, it was standing room only. There was a sea of deaf people, predominantly African Americans, ready with cameras in hand, wanting their photo ops with these two icons. Because the word had gotten out that important people was coming to address their community. And for African American deaf people, this is a rare occasion. And they were going to take advantage of it. Cameras and all. So the room was full of excitement, while the reverends and our other special guests were awestruck. And for them, it was a wow moment. Dr. Walker asked me, where did all these deaf people come from?
Thank you.
Because you see, for Dr. Walker and for Reverend Sharpton, they agreed to come because they supported our ministry in the deaf community. And from the time I became involved in 1995, through the ministry of my church, they were also, to some extent, involved. So it was not about their support that was in question, but it was their definition of a deaf community. Because they did not expect to see that many black deaf people in one place, because their reference point was based on the deaf people they see in their churches and in religious settings. And we know that's 5, 6, 4, not a lot. So where is this deaf community hiding? And how come you haven't seen them? Well, let me enlighten you. You don't recognize them because they look like you and I. And unless they start communicating in sign language, you have no way of knowing whether people are deaf or hearing. They are right here living throughout the city, and like you and I, they love having a good time. They love good food, they love good music, they love entertainment, and they love fellowship. But unfortunately, there are not a lot of venues where African American deaf people can come together for socialization, entertainment, or meetings. So when they do get together, it is often a wow moment for somebody. So in June of 1999, we sealed a total commitment from Dr. Walker and from Reverend Sharpton, for they themselves had witnessed a black deaf community. They got it, they understood it, and they understood that this community would need their support. It was also in 1999 that I, along with two other interpreters, Joan Canada and A.J. Jones, who's sitting here at the end, began interpreting at the National Action Network, and we opened up that venue to African American interpreting students, a friendly place for African American students as well. There are no venues open for them. So they came to sharpen their skills and at the same time help us to establish a friendly environment for deaf people. So from 1999 to 2007, we worked to build a trusting relationship between us, who represented a hearing organization, and the deaf community. And we continue to educate and advocate within National Action Network so that we could create a comfortable environment. And it was not until 2007 that we established a program there where the deaf are not only members, but they plan their own events and their own activities. So who am I talking about? Well, let me tell you. They are black deaf parents who fight for their children's education. They are black deaf children who fight for the right to achieve their dreams. I'm talking about black deaf professionals who still struggle for their rightful recognition. They are deaf teachers, they are deaf poets, they are writers, they are comedians, they are lawyers. As a matter of fact, the first black deaf lawyer in the United States came from New York City. I'm talking about black deaf business people, one of whom we honored at our banquet. He is a Wall Street day trader, and he is working towards getting his PhD in finance.
All right.
I'm talking about deaf people. I'm talking about deaf people in this city who volunteer within their own professional organizations, advocating for equal access in all walks of life. They are vigilant, they are resilient in controlling their own lives, not our way, but their deaf way. They are members of Black Deaf Advocates, Deaf and Hard of Hearing Parents Association, Deaf Women of Color, the National Alliance of Black Interpreters, and, of course, House of Justice Deaf Club. That's just to name a few. They are employed by hearing organizations like the Barrier Free Living Center and the Harlem Independent Living Center, where individually they are making a difference because they fight for equal access within the court system. Educating and working with police department to eliminate brutality and discrimination against deaf people. And hopefully you saw there was an article in the Amsterdam News a couple of weeks ago that featured Christina Curry, who is the executive director of the Harlem Independent Living Center, a deaf woman. They are volunteers as mentors to Black deaf youth who are discouraged from pursuing a college education. I'm talking about deaf pastors, deaf social workers, deaf actors, and deaf interpreters, all struggling for equal access in their specialized fields. Yes, they are deaf and hard of hearing, but they are able to communicate and are always willing to teach you how to communicate with the deaf using American Sign Language, gestures, or just pen and paper. They do not seek pity nor compassion. They just want to be treated fairly. And so this evening, I thank God for your interest. How and what you can do to demonstrate your awareness is always worth thinking about. You can invite them to become a part of your organization, but what would that mean? Would they be active members or would they be tokens? Does your budget support interpreting services? Or do you have interpreters right here in your ranks that would be willing to donate time and service to support such a program? Or would you just want to partner with an organization? You can always partner with us, the House of Justice Deaf Club. Or maybe you have something else in mind. Yes, this culturally Black deaf community individually live all over the city, sharing their same experiences, same history, customs, and values. They come together sometimes as a small group and sometimes as a large gathering. But the point is, the barrier that separates you from the African American deaf community needs to come down. But remember, their past experiences with hearing people have had its downside. So I can't make promises for the deaf community, but I can definitively say that we at the National Action Network, Interpreters Advocates Committee, and our Deaf Club members look forward to a long-standing relationship with this branch of NAACP. So again, I thank you for the invitation, and I thank you for listening. God bless you and love.
Next, we're going to move along to preserve our legacy.
We want to thank NAACP for inviting us here today to speak, as well as Ms. Babette, Ms. Wilma, as well as Mr. Eaton, Jeffrey, for having us here. We spoke to him a few weeks ago about our organization, but just to give you a little background, again, my name is Shana Milius. I'm actually a publicist. I work in the music industry, but I also started working with a lot of political figures when we had met this little boy. His name is Jaden. Jaden, at the time we met him, he was 2 years old. One of my clients, I'm not sure if you're familiar with Rucker Park, EBC, so they have a celebrity basketball league that generally takes place in the summer. It's on 155th Street in Harlem. Yes. Well, this particular year, 2005, actually, no, 2006, we were contacted by an organization, I'm not sure if you heard of them, they're called DKMS. Okay. They had just come to America, and Jaden actually was their first client. Jaden was 2, he was diagnosed with AML, leukemia. At the time, he needed a bone marrow transplant. We weren't really familiar with that. They actually, DKMS tried to come to the courts to try to register people, but you know, we weren't really receptive. We didn't really know in detail. You know, it sounded painful when we were informed about registering as a donor. That was April of 2006. In August, we hosted a game, which we did every year, at the Garden. It's a celebrity basketball game where we would have, you know, people, a lot of celebrities come in, you know, to basically play each other, and Jaden was there. At the time, he was in remission, so we thought that he was okay. You know, we didn't really think too much about him until we were contacted again. We were contacted actually in October of 2006, and they stated that Jaden had relapsed, and if he didn't find a match, he was going to die. Apparently, how it works, especially with us being African American. I'm African American, Cuban, Irish, Scottish. Variation goes on. And just like him, you know, his parents were not a match, nor was his sibling. So that meant he had to find an unrelated donor. So the basis at the time, we didn't really understand why it didn't work, because we thought it was something with your blood. It's not with your blood. It has nothing to do with your blood type, anything like that. It's basically based on your DNA, your genetic structure, in order to be a match. So in October, we thought we would do something. We were planning an event, All-Star Weekend of 2007, to try to find a donor for Jaden. We had various celebrities that were going to participate, and unfortunately 2 weeks before the event, Jaden passed away. With that, we went to the funeral, and we were really moved at the time. We looked at it as, you know, if we have children, we're, you know, an interracial couple, obviously. If we have children and our children get sick, the more likelihood of them finding a donor would be really hard. So we wanted to do something about it. A few weeks later, we actually met Reverend Jesse Jackson, and we told him about Jaden and, you know, what is it that we can do. And one thing that he pointed out was that, you know, within our community, we don't do things, you know, like we might say that there is a child, this child is sick or whatever, but then a few weeks later you don't hear about it. He said in the Caucasian communities, he said they do things, they make legislation. You need to get legislation for this. So Brett and I actually co-wrote legislation, and it actually passed in New Jersey. It's called Jaden's Law, Assembly Bill 2168, Senate Bill 2038. That's in New Jersey. Basically what it is, it's an online brochure that the Department of Health and Senior Service provides for individuals and doctors to inform their patients that, look, there's a disparity issue within the minority community. It also explains what bone marrow donation is. It explains what bone marrow is, as well as PBSC, which is peripheral blood stem cells. It explains what that is. But it's an online brochure about the information. It's more of an educational tool. What we realized was individuals like us didn't really know. And I think if it was explained to them, explained to individuals, more people would increase in levels of donorship. And in addition, we just, this year actually, it was introduced Jaden's Law again. Assemblyman Keith Wright, I'm not sure if you're familiar with him.
I remember this branch.
Well, he actually introduced Jaden's Law here in New York. He introduced it actually June 30th of last year, but then he reintroduced it in February. So one thing we want to commend him and thank him for, officially for New York State, May 3rd is Bone Marrow and Umbilical Cord Blood Donation Day in New York State. So he actually provided us with the resolution for that. We're still trying to get that bill passed. So if you could, you know, contact your legislators here in New York to let them know Jaden's Law is a must. And the basis of the New York Jaden's Law, it's a little bit different than the legislation in New Jersey, is that one, it does provide the online brochure, there's a few additional options that it provides. One is on your driver's license, you will now have the option to be able to register as a bone marrow donor. In addition, on your voter registration card, you will be able to register as a bone marrow donor, as well as New York State has something called anatomical gifts. You also have the option with the ability to donate your bone marrow when you pass away. A couple of things too we want to enlighten you on as well. Just want to show you this really quickly. I explained that when you're registering, it's more of your DNA. And I'm not sure if any of you, have you ever taken a DNA test or seen anything like that? Okay. So basically, Be the Match Registry is actually the federal organization that's here for America that helps collect, they maintain the database. Registering as a bone marrow donor is very simple. It's 10 seconds. They actually have 4 swabs, 2 on each side, but all it is a circular motion. This is just as simple as this, 4 times on a sheet here, and you're basically entered into the National Registry. Now the ages are 18 to 60. I also want to stress the importance in regards to the race variation, just so you know how severe it is for us. Hispanics right now represent 10% of the National Registry. African Americans, in 2009, they represented 8%. 2010, they represent 7% of the National Registry. Asians, 7% of the National Registry. Pacific Islanders, 3% of the National Registry. Native Americans, 1% of the National Registry. Caucasians represent over 70% of the National Registry. So what does that really mean? It means that if you know someone that has cancer, they've been diagnosed breast cancer, leukemia, lupus, anything, the likelihood of them finding a match is very slim, extremely slim for them. So the main thing is to get the awareness out there, and that's part of the reason why we started the organization Preserve Our Legacy. And you want to talk about the treatment options it provides?
Well, so yeah, with this said, these cord blood units, as well as bone marrow donation, can treat and in some cases even cure, like sickle cell anemia. And we have people that we've met through doing this who have the testimonies, who have gotten treatments and who are cured or treated and alive today because of these options that were out there through adult stem cells. So that is, it's just huge, to have met these people, as well as,
And again, as we were explaining, there's 2 options to you registering. One is, as I said, you're entering the registry here, and then genetically, everyone has some type of genetic twin. Generally, they're looking for a 5 out of 6 genetic match in order to see if you can be a donor for someone. There's also umbilical cord blood donation, and this is actually, we have a few brochures we'll leave here. But basically what that is, and I'm not sure if there's a lot of women in here, I'm sure you've delivered children. Generally what they offer is the private option, meaning there's a fee associated with it. This program, there's no fee associated with it, and you're donating it. And what happens is, when a woman gives birth to her child, after the baby is saved, the placenta and the umbilical cord, they actually withdraw the blood from there, and then it basically ships. Our program right now, we've established history in the last few years with our legislation as well as with this program. And Eleanor, would you mind standing up? Eleanor Griffin actually runs the program at Harlem Hospital.
Hi, everyone.
And she speaks to women every day, encouraging them to register as, to donate their cord blood. It's free. It's generally considered medical waste. Our goal is, in America, there's about 4 million births a year. If we can get 10% of those people to register or donate their umbilical cord blood, there's so many lives that can be saved. And just with us being African American, diabetes can be treated with a stem cell transplant. Lupus, heart disease, anything with your pancreas, any type of cancer, any type of blood disease specifically, it can be treated. And on the basis of it. I'm sorry? Oh, cerebral palsy. I mean, there's about 76 diseases that can be treated, but within our communities, they don't really know about this, and this is something that we definitely have to encourage people to speak about and ask questions about, especially with your doctors, because they know this information. Instead of someone taking insulin for their diabetes, if you have a stem cell transplant, you will no longer need insulin. And the basis of it is generally your pancreas is where the damaged cells are. Stem cells basically, can everyone just do this? Can you scratch your hand just like this? Do you see the white that comes up? Those are dead stem cells. We all have those. It's not, there's variations of them. There's an embryonic, which is the mad scientist, which is more with stem cell research that they're utilizing. And then there's adult, which we all have. And it generally, we rejuvenate it on our own, within our own bodies. And it's something that can help someone. I'm sure you've fallen when you were about 5 years old. There's a scab on your knee, because I have a couple of those. But, if you see that right now, it's not like the sore that you had initially. Those are your stem cells. So,
also, I want to talk about a lot of people misconceive about bone marrow donation. They think it's going to be painful. And actually, we know of someone who actually donated to their own brother. She was 12 years old, and she was out of the hospital that same day, running around playing. So if she can donate her bone marrow to save a life, why can't an adult do it just as easy? Basically, there's two methods that they do if you are called upon and you are a match. And that would be peripheral blood, which is what Shana mentioned earlier, the PBSC. They would take it out through an IV and take out the stem cells that way. The other option would be, actually, it sounds crazy, but drilling into your hip bone to extract these precious cells that can treat these diseases.
but you're getting anesthesia.
Yeah, you're under anesthesia.
You're getting
And like I said, you're in
anesthesia.
and out of the hospital the same day.
45 minutes. And
You
then
know,
the PBSC donation is, I'm sure you know someone that's had dialysis. It's the same procedure, similar procedure. Someone that's donated platelets. It's the exact similar procedure in regards to donating.
And that's the more today way of doing it,
Right.
instead of the actual
hip.
drilling and the.
So there's been a lot of people that actually registered, men, women, the next day. It's not as bad as it sounds. So our goal is to more so educate the community about the need as well as the process so that they can be aware of it, so that if someone, just say, I'm sure you've heard of Jasmina, Shannon Tavares, but there's thousands of children in America that are passing away because people are not registering. So the goal is to get as many people as possible educated on this so that they can become donors and they can call and get information. If you know someone that's pregnant, we're going to give you the website, and Eleanor, actually, she can give out her number. You can contact her and tell them, we will be able to provide them kits throughout New York, and to try to help to increase those numbers. We also, in a few weeks, we're going to have an announcement at Harlem Hospital announcing our program, but also there's a young man, his name is Sean, a DBA. In 2009, he graduated from Yale Law School. He is from Nigeria. He basically, a few weeks later after graduation, was diagnosed with leukemia. He was told he needed to find a donor immediately or he was not going to survive. Fortunate for Sean, in January of 2010, he had an umbilical cord blood transplant. Basically, Sean is alive today because of his umbilical cord blood transplant. We actually have started a sponsorship with him. Sean is actually going to be the first Nigerian to enter the Olympics, the Winter Olympics, in 2014. With that, he's going to include our brochure as well as he's doing the skeleton run. And I'm not sure if you're familiar with that.
Yeah, we were. It's head first, down
like bobsledding.
Like bobsledding, but you head first. this low to the ground, speeding down the hill. Yeah, it's crazy. So he's gonna, sponsor. We're gonna sponsor him. He's gonna have our logo on his jersey, on his uniform, as well as a sled. So that was, a huge.
And sponsor, we don't mean financial sponsor, we mean sponsor is in regards to creating the awareness as well as providing branding the needs throughout the world. That's basically it. Anyone have any question? Or Tiffany? And we have Tiffany and Eleanor, yes.
Hello. Yeah, I just wanted to a little further on the umbilical cord blood down at Harlem Hospital. Also, we want to make sure that everyone is aware that you can come to the hospital even though you're not going to deliver at Harlem Hospital, but what we can do is interview the girls there, and we also educate them, and we give them basically this package, which provides them with the application, and also along with some information about umbilical cord blood and some, I don't know if it's gross for some people, but I showed the extraction of the blood. They have everything in here that they need in this package that will educate them, and also they get the chance to sit down and speak with me. I see over 100 girls a week at the clinic, and this is a program that I feel very good about, very proud about, because as a community, we're so low on the national registry. It's really a pleasure. These girls are getting so excited about donating their cord blood, and you know you cannot do it unless you're pregnant, right? Everyone knows that. You gotta be pregnant. My time has passed, but these young women that come to the clinic at Harlem Hospital, they're so excited about it. They grab the information, they want the material, they want to learn more about it. They go on the website, they come back and they see me, and they say, yes, I went on the website. Please sign me up. I want to sign up right now. I want to save a life. So this is something that we have to really get it out there to the public, to our communities, to the community, and let them know that this is something that's necessary, this is something that is needed. So again, you don't have to deliver at Harlem Hospital. Any woman that would like to donate their cord blood, we are more than happy to allow them to complete an application. We will give them the application. They have to go to their doctor. Their doctor must agree and sign the application that they will extract at the end, and we will pick it up from any hospital in the 5 boroughs of New York. Okay? Any questions about umbilical cord blood?
Wait, Tiffany's going to speak.
Tiffany, I'm sorry, Tiffany. Thank you.
Hello, my name is Tiffany Hilton. I just wanted to add on to what everyone has already said, just a little bit about the organization. Preserve Our Legacy was initially started by Brett and Shayna, and one thing that they mentioned and everybody kind of screamed is just what the process is in regards to extracting the umbilical cord, cord blood. If you do not get the peripheral blood transfusion, which happens now about 80% of the time, and the other option is that you would have to have the bone marrow extracted from your hip. It is a painful procedure, but just from our experience, nothing is more painful than seeing a child put in a small pine box. So if you have to do something that might be a little hurtful or something that may take you out of your comfort zone, it's a real obligation when you fill out the form. We don't ask people to just do it because at the moment they have an urge to sign up because they see everyone else doing it. When you fill out this form and your data is taken, families are notified if you are a match. And if you could imagine the anguish that a family will feel if they're notified and then later told, oh, this person reneged and this person doesn't want to do it. So we do ask people to be serious about their inquiries. I also want to say a sidebar to what Shayna mentioned regarding Sean. He's the young man who found a donor. He had the means and was able to travel to his native homeland of Nigeria. So this young man traveled across the seas to another continent in order to find a match. And the reality is most African Americans do not have the means to go travel the world to find a match. So we're trying to do what can be done here to help the average person that works every day, the average person that may be on Medicaid or that may not have the means that other people have. The United Negro College Fund, the NAACP, which has been in existence for over 100 years, has been in existence because people of color have understood the need to take things into their own hands. Shayna and Brett have started this organization. This is their full-time 24 hours a day. This is what they do. Eleanor, this is her full-time job. Our organization is not supported by any federal grant. It's not supported by any type of money. It is supported because there are kindness of people's hearts who donate, and whenever we find benefactors. So all of this, every brochure you see printed is done because people have decided to dedicate their life to this. So we just want to ask anyone who has any organizations that would like to partner with us, any groups that we can speak with, so we can spread this message, because the message is about bone marrow donation, but it's also about independency and advocacy. As Black people, as people of color, as minority groups, to advocate for yourself and understand what your rights are when it comes to health care. There's huge health care disparities in this country, and they primarily exist because people of color do not know what rights they have, and people of color do not advocate for themselves. So do what other groups do and advocate, and this will soon be a conversation we don't have to have.
So Open Kitchen is our last presentation. They're going to talk to us for a couple of minutes about healthy eating and the things we need to do, and then we'll close out. Thank you.
Thank you so much. Good evening, everyone. How's everyone doing tonight? Yeah. Great. Thank you so much for having us. Thank you, Ms. Hudson, and for the Health Committee, and Ms. Brown. It's really our pleasure to be here tonight. Thank you all for your patience. I know you're all ready for some food, and here we are about to talk to you about food, torturing you a little bit. My name is Josh Wessler. And before we introduce ourselves, I'll just give you a quick picture of what we're going to talk about. We're going to talk about our campaign to really inspire home cooking throughout the city, but focusing on the Harlem area. And we have a workshop model that we're going to present to you, and then we want to take it to the next level, and I think you all can help us do that. So again, my name is Josh Wessler. I live in the Harlem area, and I work full-time at the Food Bank for New York City with the Cook Shop program, which some of you may be familiar with. It's a nutrition, education, food exploration program throughout the city in elementary schools. We're working with about 30,000 students right now, and that's what I do professionally. And then in my free time, I'm a member of a garden in the Harlem area, as well as a community-supported agriculture group. And then I also work on this campaign, Open Kitchen Workshop.
My name is Sarah Frank, and I work with a nonprofit called Health Corps, which is a health promotion organization founded by Dr. Oz that places health educators in high schools all over the country to promote wellness. And through my work with Health Corps, I teach a lot of cooking classes, and I realized, that's really something that I love to do and feel is really important. And so that sort of, Josh and I both work in nutrition education and cooking, and so we were like, well, we want to do this in our free time. So Open Kitchen Workshop is not our job, it's just something that we wanted to do. And so just to give you a little background, we got involved with an organization called Harlem 4, which some of you might be familiar with. It is called Harlem for Change, and it was born out of the Harlem for Obama campaign and the Harlem for Obama office. And they were organizing a food summit. We were like, well, perfect, we're totally into food. Like, what can we do? So we started coming to these meetings, and we attended a workshop, and we were like, well, we could teach a workshop. We love cooking, and we both, professionally know how to teach cooking to kids. We could probably teach it to adults. Let's see how it goes. And so we taught this workshop, and it was really successful. We taught people how to make 2 different one-dish meals. And the idea of the workshop was not to come up and say, we're chefs and let us teach you really fancy techniques. It was just to say, we think cooking is important, and we cook at home, and here are some recipes that are cheap and really healthy, and not too hard to make, and here's how you can teach this to someone else. So the idea is to create something that's viral, something where we're saying, let's not, go out to eat together, but let's, come over and bring a carrot, and I'll bring some beans, and let's see what we can make together. So that's sort of where all of this is coming from, and we've been thinking, how can we move this forward, and doing some different workshops in the community, and so we're going to tell you a little more about that. And we both live in the Harlem area, and so we wanted to get involved in the neighborhood where we live. So that's sort of what brought us to this. And I work full-time in a school that's on 102nd. So that's sort of the beginning story. And then our mission is really to inspire people to cook, because in our view, you can't eat healthy food on a budget unless you learn how to cook. And a lot of people are pressed for time. People don't have time to cook. They need ideas of things to cook that are easy. But also we need to re-inspire people, especially younger people, to make cooking more of a priority. So one thing that I say to my students, I work with high school students, is, you know, I don't really have a TV. Like I watch some TV shows on my computer. I'm not like totally out of the loop, but I cook. That's like an activity. You know, we come home and we cook dinner. And that's part of our activity. We're talking, we're listening to music, the radio, whatever. And so if people can find time to watch TV, they can find time to cook. And so what we're sort of looking at is trying to create community around cooking. People love eating. And when you cook something together, it's that much better. I just, before coming here, did a cooking class with some students, and we made quesadillas. With chicken and vegetables and some cheese, obviously, and some barbecue sauce. And the students were like not wanting to put barbecue sauce in these quesadillas. I did not know why. And I insisted that they put it in because I knew they would really like it, because I know that they like barbecue chicken. And afterwards, they were like, "This is so good." And I was like, "Yeah, it's a good recipe." They were like, "No, it's good because we made it." And I was like, "Oh, okay, I'll take it." So that's the idea. And we've done a lot of things. You know, we've worked with adults, we've worked with kids, and we've worked with adults and kids together in schools. And one thing that we see is that a lot of people have a lack of confidence. So we'll teach this cooking workshop, and they'll be like, "Oh gosh, you know, where did you get trained as a chef?" We're like, "Well, we're not chefs. Like, we just cook at home sometimes." And you know, we've got some books and watched some videos on YouTube about how to do this or that. But I think people really have a lack of confidence in their own cooking skills, and so that's another sort of aspect of the goals of our program. So Josh is going to tell you a little more about what our workshop model is.
Yeah. So again, the first most important thing is to get buy-in from the group. And as Sarah mentioned, you know, when we stand in front of a group, you know, we talk about, we say healthy food, or we say cooking, and people have a million questions for us. But the first thing we say is, we're not teaching you how to cook. We're teaching you how to teach someone else how to cook. Because, you know, regardless of your skill level, you know, it's just a really great way to gain access and get that mutual buy-in, because then we're sharing. Because then no matter what experience you have, you can participate in that workshop, and everyone's sort of on an equal playing field. So that's really the first thing that we do. And all of our workshops are completely hands-on. Everyone is involved in every step of the process, assigning jobs and taking part in the preparation. And as Sarah mentioned, these skills are very basic. You know, we always talk about different tricks that you can use for any aspect of food preparation, selecting food, choosing a recipe, different preparation techniques. And again, members of the group are all joining in. And as Sarah mentioned, people are always asking us, "Oh, where do you train? Where do you learn how to cook?" And when we say we cook at home, we just teach ourselves. You know, a light bulb sort of goes off. And that's a really important part of the workshop model that we want to present to you. I'll talk about that a little bit later. The other piece is that it's intergenerational, working with kids and adults, because when the kids say, "Oh, I want to cook," well, I mean, you've won the battle right there, or at least a good portion of it, because they're going to go home and demand, "Oh, you know, I learned this great recipe, let's make this, it's really simple." If they go to the store with the parents, they are going to say, you know, "Can we try this thing right there?" That's really the way to win over the kids, rather than forcing them, I think, to eat something they may not want to eat. Again, all of these recipes are easy, fresh, affordable, and you can really easily add in anything else you want. We cook plant-based recipes, but we don't say you have to be vegetarian to be healthy, but that really makes the recipes more flexible. You can really do anything with them. And then we create a very comfortable space to share, as I mentioned before. So we have this workshop model, and I wish we could sort of do something right here in front of you all. We did a workshop with Ms. Brown up at a public school in Harlem. We've done it in various schools throughout Harlem and community-based organizations, and the response is always overwhelmingly positive. And that's really, again, pretty much just due to people getting in hands-on interaction with food and with cooking. So we have this model for a workshop, but we're volunteers and we can't do this full time. We love teaching cooking workshops, but we hope to sort of show you that it's very easy for you, in fact, from whatever organization you're coming from, whether it's faith-based or a school or any community-based organization, to in fact lead these workshops. And we have materials that we would love to share regarding what materials you'll need to lead a workshop, very basic materials. Recipes. In fact, we have some postcards in the back with our information, our contact information, as well as a recipe on the back to get you started. And what we've been discussing is basically how to scale this up, because again, it's going to take an entire community to really inspire the type of, or the scale of cooking that we're talking about, just to get people talking about it and in the kitchen. So what we'd like to do is speak with you all individually, take any questions of course, but if you're interested at all in this, we have a sign-up sheet in the back so that we can provide materials and really show that with a small investment of money, to get the materials and time to maybe come for a training. We could host a training with potential workshop leaders, and again, you don't need to be a professional chef. These are very, very basic. To host these workshops in your own organizations, and this is something that could go on for years. It's a very easy model. So yeah, we'd really like to, I guess, sort of network with everyone and hear what you have to say. Our idea is to have this sort of viral campaign, whether it's people going online and saying, I've cooked at home for the first time, or for the umpteenth time, or sending us a postcard and telling us that they've cooked a meal at home. I think it's really important when people say, well, people aren't interested in cooking and being healthy. I think that's absolutely not true. I think we all know that's not true. It's a matter of money, experience, access to skills and time, but also, as Sarah said, priorities, and really that first buy-in, feeling more confident in the kitchen. And I think that the workshop model that we have hopefully really gets at those barriers to cooking.
And just to close, the idea of the Open Kitchen Workshop is the name, is that you participate in something, you connect, and you open your kitchen. And so the idea is just bringing in someone. I learned in some of the training for my job the best way to cut an onion without crying. I swear to you, this totally works. It's so easy, and it makes, if you don't put onions, if you don't put seasoning in your healthy food, you're not gonna eat it. It's like, healthy food doesn't always taste good. You have to know. You have to be willing to experiment. And so the idea is, open your kitchen, and we want to be creating sort of a space for people to do that and to be communicating with each other. So we're really thankful for being here today and being able to present, and we'd really just love to know, while people eat and socialize, what you think and what ideas you might have that we could incorporate moving forward.
And so just to summarize, we have postcards in the back, we have a sign-up sheet, and we're also going to have information about the CSA, which is the Community Supported Agriculture Group, which is a farm share subscription to a farm for fresh vegetables every week from a farm we work with. That's located in the Harlem area. So that information will be in the back. Thank you so much for your time.
A young woman came in this evening, come around, stand right there, and what she said to me is that I work with the Alzheimer's Association. One of the things that we've discovered is Music is good for the soul, which we all know anyway. So she's going to explain us quickly what to do with your old iPods.
1 minute.
1 minute.
Sure. We volunteer with the Alzheimer's Association, and they collect unused iPods. They found that with everything else, when the brain is destroyed, something about music, memories of songs they knew or whatever, still stays with them. So they collect the iPods that they download, or playlist, whatever you call that, I don't have it, into it, and it's based on whether it's the music from the 40s, the 50s, whatever they remember. Or their family knows that they like certain songs, they'll put them in. And they have found that that part of the brain still works for some reason. So if anyone has unused iPods, you can see me at any meeting and give them to me, or you can ask me afterwards for the address where they are on Lexington Avenue. Alzheimer's does an awful lot, so if you have family or friends or someone you think might be getting it, they have workshops that start from the beginning, early stages, right through the Alzheimer's thing. That's it, I'm through.
So that's the end of the Health Committee program. We hope that people have learned something this evening. I want to once again remind people, if they'd like to swab, I'm going to set them up upstairs and you can come up and do it. I turn it
I
over to
wanted
you,
to
Ryan.
commend Babette Hudson for this excellent presentation. We know Canaan has excellent deaf ministry, and for, I guess the couple from Preserva, we want to thank you also for coming, and the young couple young people who came to represent, I guess, the Open Kitchen, and all the panelists. So we want to thank you for your time and also for the information that you provided.